Hello, my name is Tristan Hutchison, and this is the ophthalmologic medication administration skills video. Make sure I have all the proper items needed, which is hand sanitizer, gloves, eye drop medication, rag, gauze, and patient with the receptacle. Can't see it's down here. Next thing, I want to make sure I verify the provider's orders and make sure I verify it by following the 6 rights of administration of medication, which would be the right patient, the right dose, the right drug, the right time, route, and documentation. The next thing, I would verify the medication with the AHR to make sure those are correct. The medication that is going to be used today is timolol, which is 0.25% solution, 1 drop in each eye twice a day. The next thing I would do is I would go inside the patient's room, make sure the patient has privacy, introduce myself. Hey, my name is Tristan. I'm going to be your nurse today. Next thing I would do is make sure I would get 2 patient identifiers. I'd ask the patient, can you please tell me your first and last name and compare it to the date of birth and the name on the bracelet. Then the next thing I would do is I would explain to the patient the procedure that's going to take place and how long it's going to take. So I say, hey, Mr. Ramirez, we're going to go ahead and provide eye drops to you. It should take about 5 minutes or so. And then the next thing I would do is make sure that my patient is in a comfortable position, make sure that the patient is in a supine position with his head slightly hyperextended, and raise the bed just a little bit to where I'm able to provide the medication to his eyes. And then the next thing I'm going to do is I'm going to let the patient know exactly what the medication is about and what he can expect from it. Okay, Mr. Ramirez, so your doctor prescribed you timolol, and it's an eye drop which that you have to administer 1 drop in each eye twice a day. I wanted to know, it's a beta blocker for your glaucoma that actually helps alleviate pressure onto your eyes. Okay. Do you have any questions? No? Okay, perfect. Also, do you have any allergy to any medications or anything like that? No? Perfect. Okay. So do I have consent to be able to administer these drops into your eye? Yes? Great. Thank you. Okay, so since I got consent, the patient knows exactly what's going to happen. The next thing I'm going to do is let the patient know what could potentially happen, signs or symptoms and adverse effects. Also, Mr. Ramirez, that with these drops, the potential symptoms that can happen, you can have a little bit of stinging while this is being administered, slight blurriness, but this is common. Adverse effects that could potentially happen, it could be fainting or shortness of breath, or lower your heart rate, or heighten your heart rate, or irregular heart rate. If any of that is to happen, please let me know so I can go ahead and stop the administration. Okay, is that okay? Yes. Okay, so Mr. Ramirez, the patient said yes, that's fine. Okay, so the next thing I'm going to do is sanitize my hands, and then I'm going to go ahead and get my gloves and put my gloves on. Okay. These gloves are a little small. Okay, so what I'm going to do is I'm going to assess the patient's eyes and what I want to look for if there's any drainage or crustation in their eyes, and if so, I'm going to go ahead and I'm going to have my rag here, and I'm going to make sure there's warm water on the rag, and I'm going to go ahead and place my hand on the patient's forehead gently and take the warm portion of the rag and start from the inside of the cantha to the outside of the cantha, and just, well, first I'm actually going to apply pressure, just slight pressure to the eye for about 1 to 2 minutes, and then once that has happened, then I'm going to go ahead and just go ahead and wipe outwards from the inner cantha to the outside of the cantha, okay? And then I'm going to do the same thing on the other side of the eye. I want to make sure I'm going to use the other end of the rag, okay, and apply the same method. I'm going to go ahead and apply the warm rag to the top of the eye, let that soak in for about 1 to 2 minutes, and then go ahead and pull from the inner cantha to the outer cantha, okay, just like that. And once that's done, I'm going to go ahead and place my rag down and take my doff my gloves, okay, put that in the proper receptacle. I'm going to go ahead and hand sanitize once again, okay, and I'm going to put on new gloves, don new gloves. The next thing I'm going to do is I'm going to go ahead and get my gauze with my I'm going to get my gloves with my gauze with my non-dominant hand, okay? And the next thing I'm going to do is I'm going to actually apply this to the patient's orbital cheekbone, okay, and apply light pressure, exposing the lower conjunctival sac, and then with my dominant hand, I'm going to go ahead and get the medication, and I'm going to just put my hand on the patient's forehead and make sure I drop, I'm going to do 1 drop of the medication, but I'm going to make sure that I'm at least 1 to 2 centimeters above the conjunctival sac, okay? If the patient blinks, then I'm going to have to repeat that process all over again, okay? Now put that in there, okay? Now, what I'm going to do is, if there is any systemic effect, what I'm going to do is actually put the gauze into the corner of the nasal lacrimal area here, and keep that on for about 30 to 60 seconds, okay? Now, the next thing I'm going to do is, once that eye is done, I'm going to go ahead and repeat the process on the other side, and I'm going to use another gauze with my non-dominant hand, apply pressure, slight pressure to the orbital cheekbone, exposing the conjunctival sac, and then grab the drops and apply just slight pressure with my dominant hand onto the forehead of the patient, and make sure I apply 1 drop. I'm 1 to 2 centimeters away from the conjunctival sac, and if the patient blinks, I have to repeat the cycle all over again, or the step again. Also, if there's adverse, if there's a systematic experience again, then what I'm going to do is take my gauze and go ahead and put it into the corner of the eye and hold it there for 30 to 60 seconds, just like that. Okay, so now the time has passed and that's done. I'm going to go ahead and dispose of the material in the correct receptacle, and then dispose of my gloves. Put these in the correct receptacle. I'm going to go ahead and hand sanitize my hands, and at that moment, I'm going to ask the patient, if the patient is comfortable, go ahead and lower the bed back down, and make sure the guardrails are up. And then next from there, I'm going to go ahead and wash my hands and make sure I document exactly what happened. And then I'll come back in and check on the patient after some time has passed to make sure There was no adverse reaction or anything like that. And they make sure that the patient has a call light and ask the patient if they're okay, and if they need anything else, they have a call light right there to be able to ask for assistance. And that's it. Thank you.